We've been recording this vodcast series at the 2024 Delegates Conference at Grindelwald's. Just wrapped up. We'll have an entire vodcast series and so many key representatives from health were here. But joining me right now, the State Secretary for our Health and Community Services Union, Robbie Moore, and Assistant State Secretary, Tammy Munro. Thank you for joining us. What were you hoping to achieve from this Delegates Conference?
First thing was to make sure that we obviously learnt a lot, which we definitely did, from so many different speakers, but also to bring delegates together from across the state, across the different industries, to realise that they're not working in isolation and that, you know, there's so many people that are doing the same thing in trying to fight to improve conditions in workplaces. So it's been a really great conference.
And you have over 400 delegates, Tammy, across Tasmania. These are people that are on the ground in healthcare, looking after your members. It must be so great to have more than 100 of them here at this conference.
It's fantastic. These are the people that are change makers in our workplaces, and bringing them together and just getting them to understand that some of the great changes our unions have made is because of them. So it was really great seeing them have those moments.
And I love that you have the theme this year was diversity is our strength, solidarity is our power. What does that mean for you, to you?
Well, our union covers everyone that works in health and community services, but they are all having the same issues, and when you bring a group together that are so diverse, but then they start discussing the issues they have in the workplace, they know the strength they've got to fight it.
As I said, there's so many keynote speakers, but had to have a representative, Robbie, from each major party. I mean, you had the Shadow Health Minister, Ella Haddad. She was here asking and taking questions too, which politicians don't normally like to take. Then, of course, you had from the Greens, Cecily Rossell, and then the new Health Minister, Jackie Petrusma. What do you think that meant, and what did you get out of that, all three of them being here? Has that happened before?
No, we've never had all three of them. In fact, it's the first time we've had the Health Minister at a HACSU conference, and I think that was a really important step. The first thing I did when Jackie Petrusma contacted me to say she was becoming the Health Minister was to say, well, the previous Minister had committed to come to the conference, you'll honour that. And I'm really glad that she did. And it was also great to hear from Labor and the Greens as well. And it was a real good opportunity for our delegates to speak to the people who are the decision makers in Parliament, who across their industries, and to raise so many issues. And I think all three of them would have left with a lot of ideas on what the problems are, but also what the solutions are. So we've now got to hold them to account and ensure that they actually listen to these people who are part of the health system and deliver on the much needed changes that we need to our health system.
And a common theme, Tammy, was when they were asking questions, the delegates, they don't feel seen and they don't feel heard. Because you've got a lot of policymakers making big decisions and they say they never get even visited or asked, what do you need to work in the healthcare system? How do we fix it?
I think one of the points was delegates standing up and saying, we hear health ministers come around and put policies in place and say they care about workers, but then when those policies are put in place, managers aren't adhering to those policies. Workers feel left behind, workers feel unsafe, workers feel at breaking point because they've seen so many health ministers come out and say we care about workers, but they're not practically seeing it on the ground. So I think it was a great opportunity for people to explain what they do. We talk about frontline workers. A lot of our delegates do essential work in this area and they're not being seen or heard or not even understood what their roles are. So it gave our delegates an opportunity to explain what they do, which is essential work.
Do you think collectively, I guess a question to both of you, they can work together? They all said that they would, Greens, Labor, Liberal. We asked them all on the vodcast, which we'll post on the HACSU socials, but do you think that they can?
Look, I'd be pretty cynical. The reality is we've seen what's happened in Parliament since the last election. We've seen parties implode. We've seen ministers have to resign because they've failed to do their job. Look, I'd love to see the parties actually sit down and work together and do what they just told health workers they're going to do. But I just don't personally see it happening. But let's hope so, and we're just going to hold them to account.
Absolutely, and I think our members will hold them to account. I think some of the points that were made from our members today, these are burning issues for them. You know, this is their livelihood, this is their everyday, this is their mental health, and I think they'll hold them to account. I don't hold much hope for them working together. I think they really should, because this is not a new issue. This is getting worse day by day, election by election, something has to change.
I want to talk about some highlights that you've had over the last 12 months in particular, since you both became State Secretary and Assistant State Secretary, and then perhaps what you're hoping to achieve over the next 12 months.
There's definitely been some highlights. It was great to reflect on them. I think, we've seen so many campaigns where members have gone above and beyond, whether it was the Hobart Clinic where nurses took on a really hostile manager, whether it was the staff in medical imaging and pharmacy that ran really good campaigns to get some pay parity and get the market allowance for them. So it was great to touch on so many things that have been achieved and for others to hear it and think, gee, I could do that in my workplace. So yeah, really enjoyed the last 2 days, and I think there's so much we can do over the next 12 months.
I'm hoping that, our aged care delegates came together and they don't frame anything as a work health and safety issue, and we had long, meaningful discussions about that, and they've realised that if they do start doing that, that'll look after them, but also the residents. So seeing that change the frame of how they work, we've got a sub-branch coming together, and I hope to see that and them pushing back on their employers about their own health and safety, which directly affects the residents. So that's a highlight for me.
We've got an incredible vodcast series that's coming up from all these keynote speakers and, most importantly, delegates, because I know they're a passion of yours, doing amazing things in the workplace.
I think when they get together for Delegates Conference, it's a wonderful thing to watch, how they talk to each other and then they connect on their stories and their strength of what they're doing in their workplace is isolated. And then that just builds each other. And I think it's a great thing, and I'm proud to be HACSU when I come together with this group. And, when they're sitting there saying, we've brought on new delegates, and one of the highlights for me was when we asked who was here for the first time, and, a quarter of the room put their hand up. I think that's fantastic.